Hello everyone and welcome back to our channel. I have something very important to talk about today, something that affects so many people but remains hidden in plain sight. What if I told you that 3.5% of women and 2% of men struggle with an eating disorder that is often hidden in plain sight? That's right, I'm talking about binge eating disorder. But before we dive into that, let's take a moment to acknowledge the elephant in the room. Why are we discussing these serious topics? Well, it's simple. We believe that knowledge is power, and by shedding light on these often misunderstood disorders, we hope to empower individuals, break down stigmas, and ultimately save lives. Now let's get back to the topic at hand, binge eating disorder. Binge eating disorder isn't just overeating during holidays. It's a complex and serious condition. Imagine this: you find yourself sitting at a table about to enjoy a meal. But as you begin to eat, something unusual happens. Time seems to fly by, and before you know it, the entire meal has vanished. Not only that, but you find yourself reaching for seconds without even realizing it. This isn't just a one-time occurrence. It's a recurring pattern that leaves you feeling ashamed, guilty, and embarrassed. In this video, we aim to shed light on this often misunderstood disorder. So if you suspect or you know someone who may be struggling with binge eating disorder, know that you're not alone. By recognizing the signs, symptoms, and available resources, you can take the first step towards recovery. Remember, there is hope and help available. Let's start with the key signs to recognize binge eating disorder. First, eating massive amounts in 2 hours or less. Second, eating until uncomfortably full. Third, eating alone or in secret. And fourth, feeling disgusted or guilty afterward. But what exactly causes binge eating disorder? The causes of binge eating disorder are complex and varied. It's not simply a matter of willpower or lack thereof. Instead, it can be attributed to a combination of genetic factors, psychological triggers, family history, and stress response patterns. Furthermore, binge eating disorder doesn't just affect one's eating habits. It can lead to a host of physical and mental health complications such as diabetes, heart disease, depression, and anxiety, which is why it's crucial to be aware of the signs and seek help if needed. The good news is that binge eating disorder is treatable. Cognitive behavioral therapy has been shown to be effective in treating binge eating disorder. Additionally, medications like Vyvanse have been FDA approved for binge eating disorder. So if you or someone you know is struggling with binge eating disorder, know that you're not alone. Help is available and recovery is possible. Reach out to a healthcare professional today and take the first step towards a healthier tomorrow. Thank you for watching. If this video helped you or someone you know, please share it with others. Together, we can spread awareness and break the stigma surrounding binge eating disorder. Remember, you're not alone. Help is available and recovery is possible.